One of the things that we know is really becoming an issue, and one of the things that we want to talk about today is the thought of prospecting and calling patients back after COVID. So as our practices begin to open back up, and we work with aesthetic cosmetic practices across the country. Now we know that from state to state, different practices are opening up at different times. So when your practice is opening back up, we know that whether you start calling patients several weeks before you're opening up, or if you're a practice that is opening up right now, calling patients is going to be the absolute #1 way that you're going to be able to let them know that you are back open. So we're going to give you tips, tricks. #1, look at all of the patients that you have, first and foremost, that have been calling you, emailing you, sending you those DMs while the practice has been shut. That is your first, we call that the low-hanging fruit, right? So once we call those patients back, we want to let them know when they're able to schedule their appointment. Even if it is 2 weeks from now, 3 weeks from now, we want to make sure that they're aware of when you can go ahead and start scheduling those appointments. That includes surgical and non-surgical procedures, esthetician-based procedures, neuromodulators / neurotoxins, laser RF, etc. You want to make sure that you have your schedule cleaned up and ready to go, and that you know when you're able to book for which procedure. So make sure, pro tip here, because a lot of people forget this, make sure that you have all of your provider schedules lined up in your EMR, in your practice management system. So you want to call back all those people that have been calling you, that those people that have been asking. That's the obvious one, right? That is the no duh about the situation. So once you have called and emailed and responded to them, next up, we want to look at any cancellations you had to make because of COVID-19. So if somebody had either their surgery or their non-surgical procedure on the schedule at any point in that time that your office was shut down, those are the next group of people that you want to call, is the people that had to reschedule or the people that you had to cancel. Third on your list, you want to call back the people who are now overdue for their treatments. So it could be, for example, with a neurotoxin. You know that a neurotoxin lasts approximately 3 months. We say, I know that some give a range between 3 and 6 months, but we know that approximately that is 3 months. So if a patient has not been back in 3 months for their neurotoxin touch-up, as an example, or longer with a filler, then it is your team's responsibility to pick up the phone and call them and let them know how much you miss them and that the practice is back open for business and that you would love to see them. Trust me, your patients, if they're anything like us, they've been looking in the mirror. They're aware that their neuromodulators and their neurotoxins may have worn off, right? Time of COVID, we understand it happens. They're aware that this may have happened, and they've been looking at them in the mirror every single day. You're not telling them anything that they don't know. So you want to call back all of those patients that are overdue. They're overdue for their microdermabrasions. They're overdue for their neurotoxins. They're overdue for their fillers. Call those patients back. It doesn't matter if they're just barely overdue. They could be 6 months overdue. Now is the time to call them. I also encourage you, look at everybody that has purchased a package. So whether that is a laser hair removal package or any other type of package that you provide in your practice, I encourage you to call them up, let them know that you're open, and you would love to get them in for that next treatment on their package, because trust me, they're excited, they're ready to get back. They just need to know what that reopen date is. So you're going to go ahead and make sure. Now you might say, but that's not additional revenue. Not necessarily. They're going to come in, and that's when you're going to talk to them about skincare. You're going to also talk to them about their other areas of concern, because if they're not coming in, you're not able to talk to them about those other areas of concern. So you want to make sure that you are bringing them back in. And the sooner they use up those treatments on those packages, the sooner they're going to be able to purchase fresh treatments. Make sure you're staying on top of your team for this, and you're communicating on a regular basis about what's working and what's not working and what needs to be adjusted, because it might be that you have the wrong person contacting the wrong type of patient, etc. make sure that you're all staying in communication in a very safe and socially distant, as needed manner.